Hi, everyone. We're going to talk about parts one and two of clinical nutrition, sort of a continuous lecture, but we'll break about 45 minutes in. So you get to get both parts of the presentation. Okay, so let's get started. So what is clinical nutrition? Well, what we need to think about is nutrition has different roles, and there's a part of it that we're probably more interested in, which is the clinical nutrition part of things. But we have to think about when we are using nutrition that we are addressing various needs. So clinical nutrition is going beyond meeting the nutrition requirements, and we're talking about doing growth and development, doing maintenance and different life stages, and also in disease management. So in terms of where does these nutritional requirements get established? Well, there is a resource that's made by the National Research Council publication, and this is considered the authority in nutritional requirements of the various species that we're interested in. And this data is then used by the pet food manufacturers, particularly in the US, to devise their pet food. This text is updated 5 to 10 years. It's for about 400 pages long, and the reading is not clinical. So this is not really used by vets in terms of figuring out what to do. This is more of the science behind nutrition requirements that then the pet food manufacturers use in creating their diets. In terms of what we use for more clinical applied nutrition, well, there's a variety of texts. So there's some encyclopedia, and some of these are sort of provided by pet food companies. And that the reason why that is because they actually employ quite a bit of nutritionists, and they're using them for education purpose. But there's a little bit of promotion, obviously, or bias in these books, but they are provided in large part by nutritionists. There are some other non-affiliated books with industry that you might use. We have participated in WikiVet, and we created various pages, and you can check that out if dysfunctional. Now, we used to be able to provide all the students that took the nutrition elective texts, pretty hefty texts, and one is the Small Animal Clinical Nutrition book. And what they actually made available now is the online chapters. So if you actually go to that website, you actually can download particular chapters. So it's a good resource to have. It's actually better than when we distributed these very, very heavy texts, because people actually then felt that they're actually too big to deal with. So some resources there. Now, what we want to actually talk about is disease management. And that's something that we feel that most vets are actually quite interested in. So let's move on to disease management. And we're going to talk about various disease processes and how to do it. So one thing to be cognizant of is that you have to manage expectations by clients. Diets don't tend to cure any condition. It's actually quite rare to do that, but it is useful in controlling clinical signs, maybe modulating the disease process, so it maybe slow down the progression, and that it usually takes time. It's very unusual for a diet change to have a very rapid impact on clinical conditions. So it's usually the long game that you want to make sure the clients understands. And also that it may require further adjustments to their diet strategy. So in some diseases, that's actually more important than others. So now let's look at GI diseases, because there's a lot of different conditions that are affected or impacted by nutrition. So it covers a wide range, but it's probably the most common set of conditions in which vets recommend diet changes. But one of the things we want to cover is that not all cases that have GI disease actually require a diet change. So let's look at inflammatory bowel disease, because that's probably one of the most common ones. It is a catch-all term. It's not a single disease. It basically means that there's inflammation in the gut resulting in the clinical signs that we see, like vomiting, diarrhea, ileus, weight loss. And within this disease, there are diet responsive forms and drug responsive forms. So just don't assume that just because you think an animal has IBD, the diet change is what is going to fix. And there's also a couple approaches that we can take. So if we believe that there's dietary hypersensitivity, so this is a true food allergy, which is actually not as common as people think within IBD. Probably like 15% of all IBD cases actually have a true hypersensitivity that you can prove. It is difficult to actually prove, and which is why maybe the rate is as low, because these patients may manifest with GI signs or even dermatological conditions. It is uncommon for an animal to have a hypersensitivity that is manifested both with skin signs and GI signs. About 10 to 15% can. Most clients won't re-challenge the pet with the original food to prove it is a hypersensitivity. And that's partially why it is so hard to come up with a number to incidence of dietary hypersensitivities. Blood tests for determining hypersensitivities are basically useless. They cannot predict whether animal truly has a hypersensitivity to what is being fed. There are two main different approaches with patients you think have hypersensitivities. There's a novel protein approach and a hydrolyzed protein approach, which is truly hypoallergenic. So with novel protein, these are not actually hypoallergenic. It does require extensive diet history, often trial and error. So sometimes animals respond very well to the first proposed diet change. Others require several sort of iterations of the diet trial. There's also problems with palatability. So just because you find a diet that is quite novel, it doesn't necessarily mean that the animal will actually eat it. Almost always, it's going to be expensive. Getting the sort of less usual food ingredients might make the diet quite expensive. Um, if most commercial novel protein diets don't work, there is the possibility of trying to make a homemade diet, but that's actually quite hard to do, to make it a complete balanced diet for long-term use. So sometimes it's useful to identify potential ingredients that you can use, but it is hard to make a long-term homemade diet plan. With the hydrolyzed diets, these are what we think are truly hypoallergenic. So basically, whatever the ingredients that are used are hydrolyzed, so the antigens are below that detected by the immune system. So remember that the immune system basically looks for an exact match to incite the reaction. And if you sometimes alter the antigen, then you're trying to become undetectable by the prime immune system. But even with that concept, it's not 100% effective. Not every patient responds. And there are, again, palatability issues. Technology to hydrolyze the diets and still make it look like pet food um, is what makes it expensive. So sometimes they're over 100 pounds a bag of food that may not even last a whole month. So that's what we cover with the sort of hypersensitivities. Now, let's move on to adverse food reactions, because they're not the actual same thing. So food reactions could still involve the immune system, but it's not a allergic reaction. So food intolerances that classically are like lactose intolerance or fiber intolerance. This is something that it might be the alternative to a true hypersensitivity. So just be aware of that distinction. Now let's look at some other GI diseases that can be managed. So let's look at pancreatic diseases. So this again encompasses several disorders. They're managed similarly, but there are special considerations for each disease. So let's look at the most classic one that most people immediately think about when they talk about pancreatic disease and GI and nutritional manipulation. So acute pancreatitis, they're again different forms. So you can see a picture showing what a normal pancreas would look like versus a quite inflamed one. And the one picture here is actually from a surgical site. So you can see that that pancreas is basically destroyed by the inflammation. So there's acute pancreatitis, there's severe acute pancreatitis, and there's necrotizing pancreatitis. So that comes in a range. So the mild self-resolving forms where it comes on very suddenly but goes away quite quickly. But then those that require hospitalization will probably be the severe acute pancreatitis and the necrotizing pancreatitis. Now, the classical approach was to treat nil per os, and until the animal stopped vomiting, we actually didn't offer anything to feed. Now we know that that's not really necessary. And actually feeding may actually enhance the recovery because food in the gut increases blood supply to the gut. And the blood supply is actually going to help sort of tackle the inflammation. Um, and the other thing that I want to emphasize that not all animals with acute pancreatitis require a low-fat diet. It is really only the patients that have a high fat as a trigger for pancreatitis, and if they show signs of lipid intolerance, and that's if they have lipemic blood or hypertriglyceridemia. Now, in those cases where food doesn't seem to be necessarily the right approach, there are other ways that we can manage them. So our go-to for providing support to critically ill animals is to use enteral nutrition, and that could be a nasopharyngeal nasogastric tube or an esophagostomy feeding tube. We only consider parenteral nutrition when we cannot manage the vomiting or abdominal pain. So usually it's after failing to achieve a good result. In these cases, again, it depends on what the trigger is and how they're tolerating whether or not we're going to feed them a low-fat diet or not. Now, when we look at chronic pancreatitis, so that this is a pattern, and there's some breeds that are more likely to have this. So, for example, the Schnauzer, both the giant and the miniature Schnauzer, Cocker Spaniels are likely to be candidates at higher risk. So these patients have recurrent signs of pancreatitis. Many have dyslipidemic disorders. So for the Schnauzers, that's part of the reason why they're prone to chronic pancreatitis. These dogs do require low-fat diets, and the diet I have here, the gastrointestinal low-fat raw canin, the dry form probably has the lowest fat content in a commercial diet. So this is something that I would usually recommend if they have that problem. Let's move on to the opposite extreme. Sometimes this comes about after severe acute pancreatitis, where now there's destruction of the pancreas, and what you're left with is a very small amount. Now, exocrine pancreatic insufficiency typically results from an autoimmune disorder where it's damaged, but there's also damage that can be done chemically by digestive enzymes. What will then follow is a malabsorptive and a malformation disorder. So that picture there is unfortunately how many of these patients become. It is a highly catabolic disease. So their resting energy requirements actually increase because of the intense inflammation. And they're hungry, they eat, but they can't absorb it. And so they have chronic diarrhea. And it's actually one of the more difficult cases to deal with because people then think about animal welfare. The owners get abused because the disease is not under control. Now, in order to manage these animals, you are going to need more than just a diet. So the diet can be low fat, but they're not going to be able to absorb it because so much damage in it. So you need to supplement them. And normally is you require to add pancreatic enzyme supplementation. And these are actually added to the food rather than just given to the patient, because what these supplements do is start the digestive process even before the animal eats it. And that's how this disease, but it does have a pretty guarded prognosis. Moving on to acute gastroenteritis. So this is one of the most common reasons for dogs and cats to actually be taken to the vet. Many are related to dietary indiscretion. So these are usually self-limited cases and don't require actual long-term plan. It is also not known if dietary changes, even temporary, like boiled chicken and rice, actually enhance the speed of recovery. A lot of this comes from people thinking that that's what would benefit them to eat something sort of mild. And we typically don't like to use the word bland because that implies that is the taste that's actually a problem. But we're actually want diets that are very easy to digest, probably low fat diet, so that it doesn't require the body to work on that too much. Now, another sort of form of more chronic disease is lymphangiectasia or protein-losing enteropathy. So these are actually difficult to manage because the dogs are very underweight and they can't tolerate a diet with a high fat. So that means there's going to be a low calorie food and they're already catabolic. So the strategy of low fat, possibly using sort of alternative lipids that don't require the body to package the fat. So when you have lymphangiectasia, the body actually doesn't know how to package the fat so it can travel in the blood properly. And by using things like medium chain triglycerides, they don't require special proteins to carry it around. These are coconut oil, for example. Now, there's a limit to how much the body can handle of MCT and also the taste. It does create problems if the diet is too high in medium chain triglycerides. Now let's move on to large intestinal disorders. So animals tend to have very frequent voluminous mucoidiarrhea, often with blood. So this little cartoon here just kind of shows the constellation of signs that you may see with an animal that has a colitis or a large bowel problem. But the one thing that we need to talk about in managing sort of large intestinal disorders is, will they respond to fiber? Right, so this is classically described as fiber responsive disorders. So colitis, constipation. There are different types of fiber and they have different properties. And when they would describe the types of fiber, they kind of fall into different sort of categories depending on the characteristics you're interested. So all fibers are in a scale of solubility. So there are the soluble and the very insoluble fibers. Fibers also have the characteristics of fermentability. Sometimes they go together, but sometimes they're a bit independent. So let's look at soluble fibers, for example. So the main sort of point of soluble fibers is that they slow gastric emptying. They slow the transit time in a small intestine, so they don't actually move through as quickly. They do increase fecal bulk by increasing bacterial growth. So soluble fibers promote bacterial growth. And that's actually good because what they do also is they're mostly fermentable as well as soluble. And the fermentation of these soluble fibers leads to the production of short chain fatty acids. So I have some examples here. So pumpkin is a classic example of a soluble fiber, but psyllium can also be used as an additive with soluble fiber. And the main benefit is that they produce short chain fatty acids. So short chain fatty acids, they're also known as volatile fatty acids. They, in themselves, slow transit time further. They decrease inflammation. They're also a main source of energy for enterocytes. So actually enterocytes, rather than glucose, they would prefer short chain fatty acids. They release GI hormone. They increase sodium water resorption by the cells, increase blood flow, and increase mucosal cell proliferation. So for those reasons, this is actually quite beneficial. So looking here, you have fiber that promotes bacterial growth, and they actually produce these fatty acids. So acetate, butyrate, propionate are forms of these fatty acids, and they go through the cell to actually infer their beneficial effects on the body. So this is one major sort of advantage to the whole solubility of fibers. Now let's go back here to insoluble fibers. So this is now a different characteristic. So some fibers are chosen because their main purpose is to speed transit time in the small intestine, and they increase the fecal bulk in the large intestine by absorbing water. So this is the type of fiber that survives the small intestine, get through the small intestine, they get to the colon, and there they actually swell. and by swelling, they absorb water, and that helps the gut modulate things. Um, Before we go to chronic kidney disease, I'm going to actually show a chart here with actually the main benefits of using this process. So if we look at this chart here, so various foods can be sort of listed and categorized into how much crude fiber they have, how much fat they have, and what type of fiber they have. So we're able then to maybe customize or predict which animals might do better with certain products. What I guess the point that I'm trying to make is you can't treat every patient the same way. You might want a different effect on a particular patient, and knowing and this information is available from the product guides from the company allows us to do that type of processing. All right, so now let's move on to um, kidney disease, chronic kidney disease, because that's actually another main reason why we want to change an animal's diet. So this is all the GI diseases, and let's look at chronic kidney disease. So chronic kidney disease is sort of the best established example where dietary modification actually improves survival. It was actually the first therapeutic diet to be developed in the veterinary field. And the main manipulations, there are a number of them, but they're usually a low protein, but the quality of protein is higher. So there's less sort of waste product produced by metabolizing it. They're typically low in phosphate. They have increased omega-3 fatty acids. So these are the three main things. And in terms of, do you have to know exactly the content? Well, probably not, but if you ever wanted to know, for a diet to be considered reduced sodium, we're looking at diets with less than 100 milligrams per 100 calories. So for every 100 calories of diet they consume, they should get less than 100 milligrams of salt. Is that really important for most cases? Probably not, because sodium chloride is not as important in hypertension as it is in people. But if you want to call a diet reducing protein, it depends on the species because dogs and cats have different levels of required protein. So if you want to say you want to feed a dog a low protein diet, we're looking at less than 5 grams per 100 calorie. But for cats, because they naturally have a much higher protein requirement, then diets with less than 7 grams per 100 kcal is considered reduced protein. Now, phosphorus is also very key in animals with chronic kidney failure. So it's less than 140 milligrams per 100 calories and less than 150 milligrams per 100 calories for the cat. This is actually the hard part to do. So you might be able to reduce protein using a non-kidney diet, but in order to get the full benefit of reducing phosphorus, you need a diet that's been specially formulated with that purpose in mind. Now, I also mentioned that these diets are typically rich in omega-3 fatty acids. So the benefits in kidney failure are reducing inflammation, lower systemic arterial blood pressure, altering plasma lipid concentration. So animals with chronic kidney disease sometimes have lipid disorders, so that is helpful. They can alter the blood flow, so increasing perfusion of the kidneys again, so that's going to preserve nephron uh, viability. Lower glomerular pressure, because the pressure actually causes damage. It might even improve appetite, and this is an important feature of animals with chronic kidney failure, and they preserve renal function. Now, it's not the easiest to find products that are suitable, so even using human concentrated fish oils might be appropriate. You just have to be aware that you don't want anything else alongside that, because in people they use it for different things, and they might actually have one that has vitamin D, for example, which you want to do on an animal that you want to give fatty acids. There are some veterinary formulations, and the key part is they has to be concentrated, because the amounts of omega-3 fatty acids in, let's say, skin supplements are not enough to actually have a pharmacological effect. If you ever have to know the dose, well, this is sort of the therapeutic doses of fish oils. And the fish oils are EPA and DHA. 40 milligrams per kilogram per day of EPA and 25 milligrams of DHA. These are actually combined in a capsule. So it's actually, the dose is something like 1 gram for every 4 to 5 kilo of body weight. So actually that could be a quite high dose. So if you think about an adult, so if you ever took fish oil supplements, you probably would only take 1 to 2 capsules a day. But a Labrador might, with using this dose scheme, might have to take 6 capsules per day. So quite a bit more than people. Right. So that's what I would have to say about chronic kidney disease. Now, I think this is probably a good time to take a break, and then we'll continue with the presentation when we actually finish off the other diseases. So this is part one. So please join us for part two. See you in a bit.